how do we actually prevent unnecessary health crises before they happen? It's a massive question, isn't it? I mean, when we're out there supporting vulnerable individuals, we often find ourselves just reacting to health emergencies rather than preventing them. But what if we had a systematic, completely objective way to spot the warning signs way before the crisis even hits?
Well, that is exactly what we are going to get into today. Welcome to this explainer covering the newly revised 2026 Pennsylvania Health Risk Screening Tool Protocol, which you probably just call the HRST. We're going to unpack exactly how this updated protocol gives support teams the exact framework they need to detect health destabilization early. And look, this guidance comes straight from the top. We're looking at the official framework laid out by the Pennsylvania Department of Human Services, specifically the Office of Developmental Programs. So this isn't just, a theory. This is the mandated standard of care designed to protect lives all across the state. Here is our roadmap for this explainer. First, we'll define what the HRST really is. Then, decode the healthcare levels, go over the strict screening timelines and triggers, figure out how to take action on those risks, and finally, break down the specific team roles and responsibilities. All right, let's jump right into Section 1. What is the HRST? And more specifically, how it measures risk, not disability. So, the absolute crucial starting point is understanding what the HRST is, and honestly, what it isn't. I see this mix up all the time in the field. The HRST gets confused with the Supports Intensity Scale, or the SIS, but they serve two totally different purposes. The SIS is a standardized assessment used to figure out the intensity of support someone needs to be successful in their home and community. The HRST, on the flip side, is uniquely designed to detect health risks and destabilization early on. It's a highly reliable, normed, and completely objective tool. It does not rely on guesswork or subjectivity. And I really want to emphasize this because it requires a bit of a shift in mindset. The HRST is not just some bureaucratic checkbox or a tedious piece of paperwork you have to file. It is an incredibly empowering tool. It's literally built to empower supporters with the exact, precise information they need to effectively oversee the health and well-being of the folks they care for. When you use this tool for careful monitoring, you are directly promoting a better quality of life, period. Moving right along to Section 2, decoding healthcare levels. We've got 22 items and 6 levels of risk to cover here. So the HRST evaluates an individual across 22 very specific rating items. And these aren't just random. They are intentionally chosen and broken down into distinct categories: functional status, behavior, physiological conditions, safety, and frequency of services. Why these? Because these are the objective, proven areas where health risk and destabilization are most likely to show up, especially in at-risk populations. The scores for each of these items pinpoint exactly where a person is experiencing heightened risk. It's like a highly targeted radar system. So how do those 22 individual items actually come together? Well, once a person is fully screened, the total points yield a healthcare level, or HCL. This ranges from level 1, which is your lowest risk, all the way up to level 6, the highest risk. And please hear me on this. This isn't just an arbitrary number generated by a computer. These healthcare levels are universally recognized as highly accurate indicators of longevity and mortality. The data shows that as HCLs increase, the odds of a shortened lifespan unfortunately increase right along with them. Which brings us to a really critical threshold, level 4. It is absolutely imperative to understand that an HCL of 4 has been strongly associated with the highest risk of unanticipated and unexpected deaths. This is exactly why the protocol insists, without exception, that users must act when HCLs increase, even if it's just by a single level. And if you see a jump that skips levels entirely, that should trigger immediate significant concern. We are literally talking about life and death data here, so we have to treat it with that level of gravity. All right, Section 3, screening timelines and triggers. Let's talk about when you actually need to screen and update this tool. Because the HRST is a living, dynamic tool, you have to keep it up to date to capture a person's real-time health status. The 2026 protocol update makes 3 distinct screening phases crystal clear. First, you have the initial screening. When someone is newly authorized to receive residential habilitation, the provider has to complete the HRST within 3 months of that authorization date. Next up are the episodic updates, which must happen within 14 days of any major health changes. And finally, the annual update. That one must be completed within 365 days of the previous screening, and specifically, you need to get it done within 90 days prior to the annual ISP planning meeting. Let's zoom in a bit on those episodic updates. You absolutely cannot just sit around and wait for the annual review if something happens in the meantime.
If a person's health deteriorates, or hey, even if it improves, the HRST must be updated within 14 days. So what actually triggers this? The obvious things, sure, like hospitalizations, ER visits, or physical injuries, but pay close attention to the more subtle triggers here. Behavioral changes, unusual shifts in their daily routine, or honestly, simply if the individual communicates that they are just feeling differently. If there is any noticeable change in their medical or behavioral condition, the clock starts. You have 14 days to update the tool.
Now, for the annual update, the 2026 protocol gets very, very specific, so don't breeze past this part. When you're in the software reviewing diagnoses and medications, if there are genuinely no changes or resolved issues, you must actively click the Reviewed No Changes button. You can't just skip it. Furthermore, all 22 rating items must be completely rescored from scratch every single year. You do this by selecting the Previous Questions button to make sure you are walking through every single question in the logic tree. This guarantees the data isn't just copied over, but is completely fresh and accurate for the year ahead. That brings us to Section 4, Taking Action on Risk. How exactly do we respond when we hit an HCL3 or higher?
When the HRST identifies an individual at a healthcare level of 3 or higher, they are officially flagged as being at a higher risk for health destabilization, and this triggers a mandatory sequence of events. First, an HRST-trained nurse, and this can be someone employed by you, contracted by the provider, or secured through intellectability, must complete a comprehensive clinical review. And please pay really close attention to the timeline here. This clinical review must be completed within 14 business days. Not regular days, business days. But here is the beauty of it. The tool doesn't just slap a scary score on a dashboard and leave you hanging to figure it out. Once fully screened, the HRST produces what are called service and training considerations. If the scores show where the risk is, these considerations tell you exactly what to do about it. They are practical, suggested action steps, like consulting specific medical specialists or identifying crucial training for your frontline supporters. And there is a fantastic piece of advice built right into the protocol here. The HRST is probably going to generate a lot of considerations. Don't panic. You aren't expected to tackle them all in one day. You need to prioritize them based on immediate need. Focus on quality action, not just ticking off a huge quantity of boxes. As you might expect, the Office of Developmental Programs takes this incredibly seriously. They've implemented the HRST as a core strategy for health and safety, making it a fully integral part of performance-based contracting. Because any increase above an HCL3 carries such a significantly increased mortality risk, ODP highly recommends utilizing the standard reports in the system to monitor these changes over time. If an individual's HCL goes up, providers need to immediately verify the accuracy of those 22 rating items, double-check that those clinical reviews are getting done on time, and absolutely confirm that all newly identified risks are being actively managed. Okay, final stretch. Section 5, Team Roles and Responsibilities, because it takes a team working together to actually mitigate this risk. It really does take a highly coordinated, multi-agency effort to transform this raw data into real safety. Let's break it down. Providers, you are on the front lines. You're ensuring updates and clinical reviews are completed while keeping an open line of communication with medical professionals and the supports coordinator. The supports coordinators, or SCs, your job is to review the HRST during those ISP meetings and ensure any identified risks are clearly captured in the health and safety focus area. The healthcare quality units, the HCQUs, they act as the administrative gatekeepers, providing technical assistance and quality assurance. And finally, the administrative entities, or AEs, they monitor the overall completion rates and integrate all this data into broader risk and quality management activities. So you see, everyone has a distinct, vital part to play in this ecosystem. But listen, none of this systemic collaboration works, literally none of it, without accurate data from the very start, which is exactly why choosing the right rater is make or break. The protocol strongly suggests a ratio of 1 reader per 25 individuals. And the ideal rater? It is not just an administrator sitting at a desk in the back office. It absolutely should be someone who knows the individual very well across various environments, someone who has full access to their health records, and, crucially, someone who supports them frequently. We're talking at least weekly. Having a rater who regularly, personally interacts with the individual just dramatically increases the likelihood that those subtle little health or behavioral changes are detected early, before they become a crisis. I want to just pause for a second on this quote. It's pulled directly from the text of the protocol itself. Early detection of health risks and destabilization prevents unnecessary deaths. I mean, it is incredibly profound when you think about it. Behind all the tight timelines, the clicking of software buttons, the 22 rating items, and tracking healthcare levels, this right here is the core mission. We are identifying risk to preserve and protect human life,
That's the whole ballgame. So I'll leave you with this final thought. Knowing what we know now, that this isn't just about regulatory compliance or filling out a form, but about proactively identifying a life-threatening crisis before it ever even happens. How will you use the HRST today to protect the lives of the individuals you support? Thank you so much for joining me for this explainer, and truly, thank you for your continued dedication to keeping the individuals you serve healthy, happy, and safe.